Hello everyone, my name is Dr. Rohit Arora. I'm a pediatrician and neonatologist at Apollo Cradle Hospital, Gurgaon. Today I'm going to talk about the influenza vaccine and its importance, especially in the context of ongoing COVID-19 pandemic. Now, a lot of parents are coming to us for the influenza vaccines with the notion in mind that it might actually prevent a COVID-19 infection for their kids. So I'll try to answer some of the queries around the influenza vaccine as to whether it can actually protect against COVID-19 or not, and whether it's useful to give this influenza vaccine to the babies or not. So the common question first of all is that what are the symptoms of influenza disease and how does influenza spread? So typically influenza disease is characterized by sudden onset of fever with muscle pains, sore throat and cough which is non-productive, so doesn't produce any sputum. Also there can be runny nose and headaches. Now influenza is transmitted through the air from the respiratory tract of an infected person when they talk, cough or sneeze, right? It can also be transmitted by touching a surface that has respiratory droplets with influenza virus in them and then touching the nose, mouth or possibly even the eyes. So that's how it spreads. Now, how serious is the influenza disease? Right? Now, although many people think of influenza as just a common cold, but it's actually a really specific and serious respiratory infection that can result in hospitalization and even death in some cases. Right? So it can become quite serious. The risk for influenza-related complications, hospitalizations, and deaths are highest among adults aged 65 years and older, children younger than 5 years of age, pregnant women, and people of any age with medical conditions such as diabetes, asthma, etc. This places them at increased risk for the complications of influenza. Right. Now, next is what is the best way to prevent influenza and how safe is flu vaccine? So actually I've given the answer to that. The best way to prevent is actually the vaccination, and it's to be given annually, right? So it's quite safe, actually, the vaccine per se. The most common side effect of influenza vaccine includes soreness, redness, or swelling at the site of injection. These reactions are temporary and occur in around 15 to 20% of cases. Only less than 1% of recipients develop symptoms such as fever, chills, and muscle aches for 1 to 2 days following the vaccination. Serious adverse reactions to influenza are extremely rare. Stuff like anaphylaxis are very rare, really extremely rare. So quite a safe vaccine we have in our hands. How often should this vaccine be given? That's another common question, because as you know probably that influenza vaccine is to be given every year. Now the reason is partly because immunity decreases after a year, and partly also because influenza virus actually undergoes small changes in its genetic material on a regular basis. It's called as antigenic shift, and this renders the current vaccine ineffective, right? So therefore new vaccines are produced annually in order to ensure that immunity to the prevailing virus strain remains. Okay, so who should take the vaccine, and is there any specific conditions in which people should definitely take flu vaccine? Now, various international and national authorities, including WHO, CDC, Ministry of Health and Family Welfare from India, all have recommended seasonal influenza vaccinations during the COVID-19 pandemic for various priority groups, including children, elderly above 65 years of age, and people with chronic medical conditions, as we discussed before, such as diabetes and asthma. So these are the age groups which are highly vulnerable. Now, COVID and flu are two different diseases. So does it have any benefit in COVID? So the answer to this is that both are viral illnesses and both present as influenza-like illness with overlapping symptoms and numerous overlaps in the risk factors and many common complications as well, right? Therefore, an assumption that there can be some cross protection towards COVID-19 through influenza vaccine is there, right? Which is actually expected, right? Although it is not proven yet and is just a notion at this point. It's not proven. Having said that, if you get influenza disease, you run the risk of reduced immunity, which may then lead to increased chances of you catching COVID infection. Thus, a flu shot surrogately protects you from COVID infection to some extent, right? So these are the common queries you get around the influenza vaccine. All right, thank you very much.